The government has intensified efforts to combat drug and substance abuse in Mashonaland Central through a 3-day provincial drug and substance abuse thematic pillar capacity building workshop underway at Baradzanwa Cultural Village in Mazowe. Officially opening the workshop, the Minister of State for Provincial Affairs and Devolution, Honorable Christopher Magomo, said drug and substance abuse remains one of the biggest threats to Zimbabwe's youth, families and national development. He challenged stakeholders to strengthen coordination, increase community awareness campaigns and improve rehabilitation programs.
Ladies and gentlemen, it is my singular honor and privilege to welcome you all to this important 3-day Provincial Drug and Substance Abuse thematic pillar capacity building workshop. Allow me at the outset to express our deepest gratitude to His Excellency, the President of the Republic of Zimbabwe, Comrade Dr. Emmerson Dambudzo Mnangagwa, whose visionary leadership led to the launch of the National Drug and Substance Abuse Strategy. Through this bold and timely intervention, the Second Republic has demonstrated its unwavering commitment to protecting Zimbabwe's greatest asset, its people, particularly our youth, from the devastating effects of drugs and substance abuse. We are equally grateful to His Excellency the President for establishing the National Committee on Drug and Substance Abuse, chaired by the Honorable Minister of Defense, Honorable O.C.Z. Muchingurika Shiri, as previously alluded to by the Permanent Secretary. The establishment of provincial drug and substance abuse committees, chaired by Ministers of State for Provincial Affairs and Devolution, has assured that the national strategy is effectively translated into concrete action of provincial, district, ward and community levels.
Honorable Magomo also commended the Second Republic for allocating 4.5 million ZiG towards drug and substance abuse programs in March Central, saying the funding demonstrates government's commitment to tackling the growing menace.
Allow me also to sincerely appreciate the Second Republic for allocating ZiG 4.5 million towards drug and substance abuse programming in Mashonaland Central Province. This significant investment is a clear demonstration that government is not merely talking about the drug menace, but it is also backing the commitment with the tangible resources. It is now our collective responsibility to ensure that these resources translate into measurable impact within our communities. Ladies and gentlemen, drug and substance abuse remains one of the greatest social, health, and economic threats facing our province and our nation. It destroys families, undermines education, fuels crime, weakens our workforce, and robs our young people of their future. This challenge cannot be addressed by one institution working in isolation. It requires coordinated, integrated, and sustained action from every thematic pillar represented here today. This workshop, therefore, comes at an opportune time. Over the next 3 days, we are gathered not merely to attend another meeting, but to strengthen our collective capacity, sharpen our understanding of our respective roles, improve coordination, and develop practical interventions that will make a real difference across Mashonaland Central Province. I therefore urge every participant to fully engage with the training sessions, openly share experiences, learn from one another, and commit yourself to implementing the knowledge acquired here. Ladies and gentlemen, At the conclusion of this workshop, I expect to see a renewed, revitalized, and results-oriented Provincial Drug and Substance Abuse Committee. I want to see thematic pillars that meet regularly and coordinate effectively. I want to receive comprehensive evidence-based thematic pillar reports submitted to my office on time, clearly outlining activities undertaken, challenges encountered, achievements realized, and recommendations for continuous improvements. Most importantly, I want to see increased visibility of our work across the province, more awareness campaigns, stronger community engagement, enhanced law enforcement, expanded rehabilitation and reintegration services, strengthened school and workplace prevention programs, and greater collaboration with the churches, traditional leaders, civil society organizations, and the private sector. With these remarks, it is now my pleasure to officially welcome you all to this Provincial Drug and Substance Abuse Thematic Pillar Capacity Building Workshop. I wish you a fruitful deliberation, productive learning, and successful outcomes. I thank you.
The workshop brings together government departments, law enforcement agencies, health professionals, traditional healers, civil society organizations, and other key stakeholders to develop practical solutions aimed at protecting communities from the harmful effects of drug and substance abuse. On a lighter note, the proceedings briefly paused as delegates came together to celebrate the birthday of Mashonaland Central Minister of State and Provincial Affairs and Devolution, Honorable Christopher Magomo.
Happy birthday to you. Happy birthday to you. Happy birthday to you, Honorable. Happy birthday to you. How old are you now? How old are you now? How old are you now, Honorable? How old are you now?
I'm 2 years.
The warm celebration reflected the appreciation of a leader widely recognized for his dedication and commitment to driving development across the province. Colleagues and delegates wished him many more years of good health, wisdom, and continued service as he leads Mashonaland Central's development agenda. A memorable moment of unity, appreciation, and celebration during the 3-day Provincial Drug and Substance Abuse Thematic Pillar Capacity Building Workshop held at Baradzanwa Cultural Center in Mazowe. Reporting for Sly Media TV, I'm Sylvester Tapfumanei.
Looking for professional home care support for your loved ones? At Children Arms Community Care, we provide compassionate care for the elderly, people with disabilities, and those needing mental health support. Our services include home care, live-in care, hospital assistance, respite care, medication management, and life skills development. We also offer an alcohol and drug rehabilitation facility, helping you live independently with dignity and confidence. Visit us at Falcon Estate, Tinwald, Harare, or call us or visit our website on the information displayed. Children Arms Community Care, fostering independence, improving lives.